So the popularity of PDO threads has been up and coming over the last several years. PDO threads have been around a long time. They've been used in cardiothoracic surgery, and they're basically dissolvable threads. They came into the aesthetic industry when we realized we could sort of structure the threads in a different way. We could make them either smooth, or we could make them coiled, or we could make them barbed, and they could address different areas of aging. What we basically do is, if we're using something looking for a bit of a lift or a bit of a facelift, then we will use the barbed threads. We make a small incision, usually somewhere around just anterior to the ear, and put the threads down into the nasolabial folds and down into the marionette lines, and it just gives a little gentle lift to the face. It doesn't give you a full-on facelift, but a gentle lift, and helps take away some of that laxity of the skin that is forming. I get asked, what does it do besides the lift? It basically leads to neocollagenesis, which is the formation of new collagen within the area, which will then tighten the skin and lift it. The threads will typically last anywhere from 6 to 9 months, and they will gradually dissolve, but the collagen that's left behind will then continue on for 12 to 18 months. I'll often use the coiled threads more into the nasolabial folds in this area here, helps fill in the sort of the heaviness within this area there, or I can use the smooth threads just in the cheek area or anywhere on the face that just leads to the formation of new collagen. Typically the procedure will take about an hour and a half, depends how many threads I'm putting in. So once we've had PDO threads done, I really don't want people opening their mouth widely after I've done the ones for the lifting on the cheeks, because I don't want those barbs being stretched and pulled. So usually for a couple of weeks, I don't want them doing a lot of smiling or a lot of chewing of steak. So the PDO thread procedure in itself is a very, very simple procedure. As I said, it takes about an hour and a half. I put a little bit of a local anesthetic in at the entry point, and then just make a little 18 gauge needle hole, and then thread the threads down through that opening. I'm kind of nice. I actually put a little bit of local all the way down the tract of where I'm putting the thread, which helps to decrease the discomfort whilst I'm putting the threads in. Once they're in, you can feel a little bit uncomfortable for a day or two afterwards, and if you do, you can have a little bit of Tylenol. Don't want people taking Advil, as it'll increase to any kind of bruising that's going on in the area. As PDO threads have become more popular over the years, we've found more and more places have been engaging in this procedure. It's really important to choose the right place to have it done. As an MD, I have a very good understanding of the underlying facial anatomy. It's extremely important to make sure that the threads get into the correct plane within the face. If they're too superficial, you'll see them bowing out, and then they have to be removed afterwards. And so this is an area that I've become very, very comfortable with, and I ensure before I cut off the threads that they are in the exact plane that I want them to be in, so you don't end up having the difficulties with threads showing and then having to have them fished out later. I often get asked, how do I know if I'm a good candidate for PDO threading? Generally speaking, it's for people who have early laxity within their face and they're looking for increased collagen or just a little bit of a lift. It'll give just a small lift like this, so in your 30s and 40s, it's a great option. As you're getting up in your 50s and 60s, you've got a lot more laxity there, the threads are not going to give the results in which you're looking for. This is Dr. Nicole Kent from Tranquil Waters Med Spa. If you think PDO threads will be right for you, give us a call at 480-638-9165 and book a consultation with myself.